Alright guys, it's Dr. Mohammed. We're going to be kicking off the public health sciences section. Now, this is a very unique section because there's no anatomy and there's no physiology, so a lot of students kind of rush through this, and the questions are easy to get right, but that also means that they're easy to get wrong. We're going to go through this nice and slow, methodically. There's going to be a ton of examples, both for the USMLE and for clinical practice, and we're going to make sure that you guys have this down pat. So the first thing that we're going to discuss is going to be ethical principles. These are the things that you need to know that you have to have in your mind before you even start talking to patients. So let's go through a couple of them. The first one is going to be autonomy. Autonomy is respecting patients as individual and respecting their choices and the right to make their own choices. Autonomy is basically creating conditions for patients to make their own choices, which is absolutely what we want to be doing when we're in the hospital. The next ethical principle that we need to know is going to be beneficence, and this is acting in the patient's best interest. This means to do good. There can sometimes be a little bit of an issue, and beneficence and autonomy can conflict, and we're going to talk about that a little bit later, so don't need to worry about it too much right now. The third ethical principle is going to be non-maleficence, and non-maleficence means to do no harm. Remember when you were just starting medical school and you took the Hippocratic Oath, one thing that you promised was that you were going to do no harm to patients, and that's exactly what non-maleficence is. And then the last of the kind of four core ethical principles is justice, and justice is treating everyone fairly. The important thing to note there is it does not mean treating everyone equally. A common example of this is triaging patients. So if you have a patient that has toe pain, you are not going to treat them the same way as someone who's having a heart attack. And that's actually a really good example of a potential question for the exam. They will give you a scenario like that about triaging patients, and they will ask you which ethical principle is being displayed. And in that case, the answer would be justice. Some important things to note is that equity does not mean equality when it comes to justice. Now, what does that mean? Let's go through and define those terms. Equity is the belief that people have different circumstances and you need to provide them enough resources to get to the same equal outcome. In contrast, equality means the belief that everyone is equal and that everyone gets the same amount of resources. For the most part in medicine, we want to tend more towards equity than we do equality, and that's exactly what justice is. That's why that's such an important ethical principle. The next ethical principle is confidentiality, and this is a big one. This is respecting patients and respecting their autonomy. When we're in the hospital, we want to keep patients' information private. We don't want to share it with people unless it's acceptable. There are certain cases in which it is acceptable to disclose information to family and friends if for some reason the patient is incapacitated or in emergency situations. And there are other exceptions beyond that in which you can share information as needed for emergent situations and for risk of harm. So two common examples. Let's say that we have a critically ill patient that is needing intubation. We probably can't talk to the patient and get their consent in that scenario. So in that case, it is acceptable, because this is an emergent situation, to speak to a family member, to update them on the patient's status, and to get consent from them. And we're going to talk a whole lot about informed consent later, so nothing you really need to worry about just yet. Another example of when it's okay to kind of share patient information is if a patient's reporting suicidal or homicidal ideation. For example, a patient comes into the hospital and they're saying, "I'm having thoughts of killing myself, but please don't tell anyone." You as the physician can share that information with acceptable parties, because in that case it is a risk of a harm to the patient themselves and potentially to other people. There are some other examples of when it is okay to share patient information, such as if there's concerns for abuse, if it's a patient with epilepsy, or if the patient has reportable diseases, such as sexually transmitted infections, hepatitis, or tuberculosis. In that case, it is okay to share that information with the respective parties, because the physician has a duty to warn the public and to notify public officials. So you really need to know some of those caveats for confidentiality. The last thing we're going to talk about is going to be accepting gifts. This is something that can be a little bit tricky, but the really important things that you need to know here is that you must weigh the benefits versus the risks, and that accepting gifts must not influence the physician-patient relationship. Now, that doesn't mean that it can never happen. There are some examples of acceptable gifts and some of unacceptable gifts. Let's go through those. Some examples of acceptable gifts are going to be something that directly benefits the patient, something that is not of substantial value, or something like a scholarship or a grant that can be used to educate others. Those are all acceptable. Examples of unacceptable gifts would be something that's a significant financial sacrifice to the patient, or gifts from pharmacy companies that may influence patient care. Those are things that are unacceptable. Some facilities, both hospitals and outpatient clinics, may even limit gifts by a specific dollar amount. And then the only other caveat that you should know is, for the most part, as a general rule of thumb, you do not want to accept cash as a gift from patients.